Hi, this video is produced by the Department of Nursing at Taipei Medical University Hospital. This video is going to talk about the importance of fall prevention. Falls usually happen particularly in older people and in patients. Several negative outcomes may be observed once fall has occurred, such as prolonged length of stay in hospital, repeated falls again, having trauma, internal bleeding, fracture, and even increased mortality rate. Fall may occur everywhere. It can be at the bedside, walk aisle, and in the bathroom. To recognize the individual with high fall risk is the first priority in fall prevention. In general, everyone has a potential risk to fall. When patients are admitted to the hospital, nurses will perform a comprehensive assessment to identify the high-risk group of fall. For example, we need to know the medical history for experience within the past 3 months, conscious level of the patients, and a stand balance test. Patients will be asked to stand by a single leg to check their balance ability. If they fail to pass the stand balance test, which indicates they are having higher risk in fall due to the inability in balance. In addition, the blood pressure measurement will be undertaken in both stand and in bed positions of inpatients. Postural hypertension is also likely to cause falls, so the blood pressure will be assessed as well. Overall, the high-risk group of fall are 1. Age over 65 years 2. Had fall experience 3. Impaired balance, unsteady gait, limb dysfunction and need to use walk aids 4. Poor sleep quality and impaired consciousness, for example, agitation or dementia 5. Complaints of vertigo or dizziness and malnutrition 6. Use of diuretics, painkillers, sedative and cardiovascular medication, and polypharmacy 7. Anemia and postural hypertension 8. Fail to pass the stand balance test 9. Frequent urination at night 10. Without caregiver 11. Post-operative anesthesia 12. Use of intravenous drip. What we need to do in fall prevention. For patients who are prone to fall, we have some suggestions regarding fall prevention. The fall prevention guide consists of 3 parts and each part includes 5 bulletin points to follow. Part 1. When patient need to get out of bed. 1. Let someone know and help when patient need to get out of bed. Do not get out of bed alone. 2. Adjust height of the bed to the lowest level. 3. Move slowly, do not rush. 4. Hold the bed rail to change the position, to sit for a while and then stand up. 5. Use an appropriate walking aid to move. Part 2. When patient needs to go to bathroom. 1. Ask someone to help to go to bathroom. Do not go to bathroom alone. 2. Turn the lights on. 3. Use an appropriate aid such as bed rail and walking aid to stand up. 4. Move slowly, do not rush. 5. Use an appropriate walking aid to move. Part 3. While walking. When patient need to walk, must have someone to accompany you and do not go alone. 2. Wear an appropriate shoes. Do not wear oversized shoes. 3. Stand stably first. 4. Walk slowly. 5. Keep aisle unobstructed and clean. Some action prone to fall. These are high-risk action prone to fall. For example, kneeling on the bed and reach out to open or close the window, or getting anything next to the bed. Sitting on the bed to get something and bend over. Getting out of bed across bed rail directly or from the gap. All these actions are prone to fall which should be avoided. Some do's and don'ts of fall prevention. 1. Use the bed-rail. Do not across the bed-rail. 2. Ask someone for help when patient need to get out of bed and remember to ring the nurse bell for further assistance. Put the nurse bell in somewhere that you can easily access to. 3. For patients who impair consciousness, if the caregiver needs to leave for a while, the nurse bell should be clamped on the patient's clothes and make it easy to reach out. 4. Put the urinal bottle or backpack close to the patient's head, which can be easy to get. 5. Get out of the bed gradually. For example, sitting on the bed for 3 to 5 minutes and do not feel dizziness. Standing up for 3 minutes and then walk. 6. Use parallel while standing in the bathroom and climbing stairs. 7. Let the nurse know when the patient would like to get out of bed at every first time. Fall prevention is important to improve patient safety in the hospital. Please join us to advocate the importance of fall prevention. Thank you.